charged more because of reproductive health issues. There is new insurance for uninsurable consumers. So there's an Illinois pre-existing condition plan. So people in the past who weren't able to get health insurance because they had pre-existing conditions can go to IPXP, that's the acronym for it, and it's on the web. And it's actually relatively affordable compared to other plans that are out there, and a lot of people have gotten coverage from that. Benefits to businesses. We get some tax rebates. Healthcare consumers, because we pay the premiums for health insurance plans, we got a rebate this past year. It wasn't much, but we're a small staff, but it was about $2,800. That helped defray the costs of paying health insurance for employees. So a lot of small businesses are benefiting from that. So those are a lot of the changes. I'm not yet talking about Medicare and Medicaid, but in terms of the health reform law, those are a lot of the changes that have happened. When somebody's telling you that they are going to repeal or oppose health reform, they want to take those things away. Okay? And it's really important for people to understand that those things don't come back easily. You can't repeal the whole law and then say we're going to pass piecemeal law to end the practice of rescinding coverage or to end the practice of lifetime limits. And the reason I don't think that's possible is because that's something that we had fought for years and years and years at the state level and at the national level, and it took a national law to make that happen. People criticized the length of the law, over 2,000 pages. Well, that's how intractable the health insurance business is, and that's the amount of work that it took to make this happen. So those are the things that would go away if health reform goes away. New things that will come are, and I won't get into too much detail about this, but the health benefits or the health insurance exchange where people will go to purchase health plans as individuals or in the small group market, there will be a lot more regulation that comes in as a result of that when that's enacted in 2014. And it'll have all the same protections that we just recently got, but in addition, some other protections. For example, one of the things that will change is that there will no longer be gender discrimination in pricing of health insurance plans. Right now in the state of Illinois, because there isn't a national law against this until 2014 when this takes effect, in the state of Illinois, insurance companies can charge a lot more for women of the same age than for men. So like small groups like Champaign County healthcare consumers, when we get our the plans and we can see what the cost is going to be, it's separated by gender, males and females, and then there are these age bands, you know, so 19 to 24, 25 to 29 or 30, something like that. And the cost for females, and we are mostly female staff, the cost for females is over 100% higher than for males. So for me, healthcare consumers is paying over $700 a month for my health insurance. Young women, 25 years old, we're paying close to $600. A male of the same age is $200 and some dollars. That goes away when the health exchange gets implemented. There are those kinds of regulations and protections. And that age or that gender rating is not legal in every state in the nation, but it's been the luck of the draw what state you live in. Now with national health reform, framework, this will go away in every state. So we're very excited about that. There will be premium subsidies to help make health insurance coverage affordable. People will go into the exchange, they will put in information, and if they're eligible for premium subsidies to help them afford the monthly cost of their health insurance, they'll get signed up for it there and they will be getting subsidies. And the subsidies are available for people up to 400% of the federal poverty level. The other thing that's going to happen that's very important is the possibility of a Medicaid expansion. And that does depend on the state, whether the state decides to take the Medicaid expansion. I think Illinois will. But what health reform does is in 2014, it expands Medicaid to cover the lower income people, but it improves Medicaid by taking away categorical eligibility. Right now, the way that Medicaid works is in order to qualify, you have to be low income, But on top of being low income, you have to meet another category. You have to meet a category like being pregnant or being the parent of a child or being deemed disabled or being elderly and low income. Those categories are going to go away in 2014, and if somebody works a minimum wage job or a little bit higher and they just meet the income criteria, they will get Medicaid. And along with that, the state of Illinois and every state that takes this Medicaid expansion will get reimbursed at 100% of the cost for the first few years. And then it'll go down to 90%. And so the federal match for the Medicaid expansion is basically, all of the costs or almost all of the costs. So those are the changes that will happen. Let's see. In terms of Medicare, I know I'm blowing through this sort of fast, but let me talk about Medicare now under health reform. Under health reform, Medicare benefits have been preserved. Nothing has changed. And you see when candidates are running, they're always talking about, if they're talking to older folks, 65 or older, none of this is going to affect you, and everybody wants to preserve things for older folks because they have a good voting record. But under health reform, all the Medicare benefits are preserved. And that's for Medicare for the future. So people like me in the future, the Medicare benefits are preserved. Health reform has expanded Medicare benefits, especially in two areas. Eliminating out-of-pocket costs for preventive services such as mammograms and colonoscopies. People were skipping those services, and those are very important. People were skipping them because of the out-of-pocket costs being too great. And it's also working to close the Medicare Part D prescription drug donut hole. And if you don't know what that is, you can ask me later, but it's a horrible, horrible insurance practice that was made legal when Part D was passed. So that's something that is being closed that currently leaves people with lots of out-of-pocket expenses for prescription drugs. Health reform added 8 years of life to the Medicare Trust Fund just by cutting the taxpayers' subsidies to insurance companies. Insurance companies, especially that had Medicare Advantage plans, were getting overpaid for services that they were not delivering. So that has been cut and has been added to the Medicare Trust Fund, and health reform has also resulted in an aggressive attack on fraud and waste in Medicare.